Mrs. Jones. My name is Cassie Meyer. Today I'm going to be inserting an indwelling catheter on you today, and I am checking my MAR and the orders, and to make sure that everything's correct, I'm going to go ahead and perform hand hygiene and check your wristband to my chart. So Jaguar J. Jones is your full name, Jaguar J. Jones. And your date of birth is 8/25/1963, and 8/25/1963 is your birthday on here. I see you have an allergy to penicillin on the chart and on your wristband. Do you have any other allergies? No? Okay, great. So Mrs. Jones, the reason we would perform a catheter is for any of these nurse-driven protocols, such as assist in healing of an open sacral or perineal wound in incontinent patients, acute ventilator dependency, respiratory failure, acute worsening of mental status, or palliative end-of-life care. So now I'm going to go ahead and let you know, Ms. Jones, that there is complete privacy in the room before we go ahead and insert that, so don't worry. Now what I'm going to do is don my goggles and gather all my supplies, which I've already done, and I've already checked my patient order forms and the hospital policies. And I'm going to gather my trash can, which is right here, and I'm going to perform hand hygiene since I touched my trash can. And then I'm going to raise the bed level up to a working height and put the guardrails down. I'm going to put my gloves on, and I'm going to position my patient in a dorsal recumbent position. So like back a little bit, and make sure the legs are spread out and slightly bent. And now what I'm going to do is tell you how I would perform perineal care. And the reason I'm doing perineal care is in order to prevent CODIs or UTIs from the insertion of a catheter. So what I would do is have a clean washcloth and first clean the inner and upper thighs, and wash them dry, and then wash the labia majora, washing from perineum to rectum, and with a clean washcloth, repeat that on the opposite side. And then I will get another clean washcloth and wipe down the middle from the clitoris to the vaginal orifice and the labia minora, making sure to wash all that, so front to back again. And then I would repeat until Mrs. Jones' perineal area was clean, and then dry. And then if I was performing perineal care on a male, I would again wash the upper thighs and dry them, and then I would grasp the penis and retract the foreskin if there was any. And starting at the meatus, working outward, I would get a clean washcloth and clean that way, and then I would throw that washcloth away, get another one, and repeat until the penis was clean. And then I would dry it in the same motion and throw that away and gently handle the patients. Okay, now I'm going to take off my clean gloves and throw them away and set up my area. So I'm going to put my trash can over here. Okay, and then I'm going to, oh, it opened, so it'd normally be a little bit more stuck together, but so I'm going to go ahead and like show you how I would open it with my arm around the patient, or around the box, and then touching only the outside borders of the box. So I would go away from me, side, and then the 1-inch border still touching only the 1-inch border. Only touching the outside of the box. Okay. Now I'm going to readjust that and don my sterile gloves. I'm gonna do it right here because I can't do it over there for you to see me. Throw this away. So touching the cuff of my glove, pulling it on. And I'm going to readjust my gloves. Okay, so I haven't touched the cups, and now I'm going to leave that there and take out the other covering, only touching the outside and shiny side down. Once it's on, I'm going to push it a little bit under my patient. I'm going to throw away the fenestrated drape, making sure not to reach over my sterile field or touching the trash can. The first thing I'm going to do is move my box a tad closer, and I'm going to first uncap or open my iodine solution and pour it on the cotton balls and the forceps, and take out my lubricant and lube the box where the catheter is going to be going. And then I'm going to take out the catheter so I would not have missed the trash can. And I'm going to lay this in the lube, 1 to 2 inches for a female and 5 to 7 inches for a male. And now I'm going to attach the water-filled syringe to the, whoa, don't move. Since everything's sterile, I'm going to readjust the catheter. Insert the water syringe into the area. So now what I'm going to do is move the boxes closer again and open the labial folds. So the first thing I'm going to do is take my forceps with my iodine solution and wipe on the farthest away fold from meatus to rectum and throw that away. And then once again on the inner fold closer to me and throw that away. And then on down the middle, starting at the clitoris and going to the rectum, and throw both of these away. Oh my goodness. So I would have that wedged between the patient rail over there. Anyway, so I'm not going to let go of the labia at all. And now what I'm going to do is take the catheter that's lubed for 1 to 2 inches and begin insertion. And I'm going to tell my patient to bear down as if you were voiding, and I'm going to insert when you exhale. And so going to slowly insert. And once I see urine, which would be quicker in a female, then I'm going to insert it 1 to 2 more inches. And if I was inserting a catheter into a male, I would insert it up to the bifurcation. So now that's inserted, I'm going to let go of the female's labia and inflate the balloon in the catheter slowly. But for time's sake, I'm going quickly. And then let go of that. Okay. So I'm just going to use the trash can that's right next to me inside that one. And what I would do now is pull back until the bladder has tension, which wouldn't be this far away. And then once there's tension, I would insert it again slightly to release the pressure on the bladder. Okay, so now what I'm going to do is take this out because I'll need it later and hang throw this away as well. And what I'm going to do is, since the sterile procedure is over, reach behind me and take out my stat lock. And I'm going to demonstrate how I would put the stat lock on my patient. So what I would do is unclip this. Okay, and then at the bifurcation, or at the little double area right there for the catheter. I'm going to clip it in and take off the adherence, the paper, and adhere the side of the stat lock to my patient's upper inner thigh. And then I would make sure there's no tension on the catheter so that there's no tension on the bladder. Okay, now I'm going to take this off for just this procedure. Normally we would keep it there, especially with an indwelling catheter. Okay, so now what I'm going to do is place the urine collection bag at a level that is below the patient's bladder, and not on the side rails, but on the bed frame of the patient's bed, and making sure that there's no dependent loop. So if that was stuck there and this was lower because it would be on the bed frame down there, then it would work out better. Okay, so now that the sterile procedure's over, I'm going to throw this away. Okay, so now what I'm going to do is clip this to the edge of the bed, or no, not the edge, the patient's bed sheets, so that this stays in place. And I'm going to demonstrate how to take out a urine sample. So first what I'm going to do is get my towel and graduated cylinder, and I'm going to position that right here. And now I have to move the camera, so make sure you can see that, and you can. Okay, so first thing I'm going to do is uncap my specimen jar, and with the cap up, place it down so that it's sterile. And then I'm going to unclamp the unclamp this and hold it over the specimen jar and not touching it, and then allow the clamp to release and let it fill up without touching the jar on the outside. And then if there's anything that spills, it would catch on the towel, and then reclamp it, and then put this back, and then recap sterilely. And then I would label and date the specimen collection jar, not on the cap but on the side. And then now I'm going to show you how I would collect a specimen from a patient who has had an indwelling catheter for any number of hours or days. And the first thing I'm going to do is kink the hose with the same clip that goes on the bed. And while urine is pooling, I'm going to get my syringe, which is actually the one I already threw away, but I know I would never get a syringe from the trash can. I would get a new one. But this is the one that fits from our blue bag, so this is what I'm going to use. And then I would get an alcohol swab and go ahead and wipe off the place where the lure lock is and throw that away. And then I'm going to go ahead and uncap this. Okay, so I'm going to go ahead and insert it and with a twisting motion so that it's locked in, and retract the urine up to 10 milliliters. And I would go slower, but for the sake of time I'm going a little bit faster. And then I would take it out, and without touching the outside of the container, making sure that all the urine goes into the urine collection specimen area, and throw that away. And then recap the vial. Again, dating it with patient's name, date, and time on that outside, not the lid. Then I would unclamp patient's tubing, and I would clean up my area. throw away my gloves and perform hand hygiene and lower the bed rails to the patient so that he's comfortable, and lower the guard rails as well. No, I'm sorry, put the side rails back up. Okay, now I'm going to document the procedure. So I'm going to document the time, the time that I place the indwelling catheter, the color consistency, and the type of the urine, and if there was a sample taken, which there was, and then I'm going to indicate how the patient tolerated it. And then I'm going to also come back and perform peritoneal care the same I described earlier every day, or if the patient becomes incontinent with stool. And then I'm going to plan to take out the catheter as soon as the nurse-driven protocol tells or explains that we should. So when their mental status is better or something like that. So now I'm going to show you how I'm going to take out the catheter. So I'm going to have some clean gloves, and I'm going to actually get the syringe. Again, I would get a clean syringe, but there's not enough in my blue bag. So I'm going to get my syringe and my clean gloves. And the first thing I'm going to do is empty my urine collection bag, and then I would look at the type and consistency, and I would put another towel down here so when I pulled it out it wouldn't be all messy. And then what I'm going to do is put on my gloves. And then what I'm going to do is make sure that the syringe is loose and pull it back 0.5 milliliter. And then I'm going to insert it into the water balloon port and let it by gravity fill again. And then once it has, I'm going to go ahead and take out the catheter. Okay. So I'm going to take out the catheter, and so it would drop onto the sterile towel that I have, and then I would put all this into the trash can and clean up my area. And then I would document how much water came out in the syringe, so make sure all 10 milliliters came out, or document if it didn't. And then I would document the tip of the, sorry, I should go ahead and take this off before I document, and perform hand hygiene. And then I would document how the patient handled it, how the patient is acting right now, if the catheter tip was still intact, how much water was left in the syringe, the type, color, odor, consistency of the urine, and how the patient handled the procedure. And then I would tell the patient to be on the lookout for a UTI symptoms, which would be fever, chills, pain with elimination and feeling like you haven't voided all the way. And then I would come back and I would also perform peritoneal care after taking out the catheter, as I described earlier. And then I would also make sure the patient voided within 4 to 6 hours, and if the patient hadn't, I would palpate the bladder for distension, and then I would also have a urine scanner to see how much urine was left in the bladder, and that's it.